You're listening to the Move to Value podcast, powered by Chess Health Solutions. The Move to Value podcast is dedicated to helping healthcare providers understand and make the transition into value-based care. We do this through conversations and the sharing of innovative ideas with practitioners, experts, and leaders throughout the healthcare industry. Our mission is to sustainably transform the healthcare experience for the patient, provider, and care team by cultivating a value-oriented, compassionate, and health-aligned community. Today we get to know Rebecca Grandy, Director of Pharmacy at Chess Health Solutions, and learn how a clinical pharmacist is an integral part of the care team, not only for improving patient outcomes by being the medication expert, but also developing relationships with the patients and being their part-time psychologist to ensure medication adherence, which results in better outcomes at a lower cost. Rebecca Grandy, welcome to the Move to Value podcast.
Yeah, thank you for having me, Thomas.
So, Rebecca, why pharmacy? Can you tell us your story of how you came to be in the role that you sit in today?
Yes, I ran out of time and ran out of options, but it was one of the best decisions that I think I've made in my career. I think like a lot of folks who go into healthcare, when I was in high school, I really enjoyed science, really enjoyed math, was good at it, and wanted to use those skills, to be helpful, to give back to the community. And so when I was in high school, I actually thought I wanted to be a pediatrician because I loved kids, worked at summer camps. I just thought that would be, a great career to combine the things I was good at and the things that I enjoyed. And so then when I went to college, I remember being in my intro to biology class, and I walk in, and it's a class of like 400 to 500 people, and they all want to be physicians. And I'm like, well, I don't really know why I chose pediatrician. Like, it just felt like the right fit. I grew up in a rural community, and so I think my knowledge of careers and job options was pretty limited, right? In healthcare, physician, nurse, that's what you do. And so after being in that intro to biology class and seeing everyone wanted to be a physician, I was like, well, I'm going to keep my options open, not put too much pressure on myself, and just sort of see where I end up going. And I decided to get a biology and chemistry in undergrad, and I knew that would really prepare me for anything in healthcare that I wanted to do. And so I just spent the next few years in college shadowing, learning, volunteering. I volunteered with physical therapist, pediatrician physical therapist. I did respiratory therapy. I did high-risk dental clinics. I did medicine, spent some time in an inpatient pharmacy, and really never found what I felt was a good fit. And so into my junior year, I was like, okay. I'm graduating in a year, and I need to make some decisions here. Because with a biology undergrad degree, you're sort of limited. I knew I didn't want to be a teacher and I didn't want to work in a lab. So I was like, okay, I got to do something here. Luckily at the time, my roommate, her boyfriend, and a good friend of mine, his dad was a consultant pharmacist. I had never heard of that. Really when I thought about pharmacy, I thought about the folks who work in retail, CVS, Walgreens, Walmart, grocery store, and really didn't know much more about pharmacy. I had spent some time in the inpatient pharmacy at UNC hospitals volunteering, but I was literally taking expired drugs off the shelf and getting rid of them. That's what they needed. So I was willing to do it, but it wasn't that exciting. And so she was like, well, have you looked into pharmacy? So being the type of person I am, I go to the library, I pull all these books about the career of pharmacy, and I'm reading about all the different options. And I'm like, okay, I like science, I like math. This pharmacy thing seems like it could be a good fit because I'd already ruled out some of the other professions. And so I ended up applying and I got in. So again, it was sort of that I explored lots of options, really ran out of choices. I felt it was something that I could be good at, and there were lots of options, and that's how I ended up in pharmacy school.
Nice. And after pharmacy school, where did your career path take?
Yeah, and it's one of those things, if you've ever talked to me before and you've heard me talk about pharmacy, I always say my mom still doesn't know exactly what I do, and that's a true statement because pharmacists can do lots beyond, being in the community pharmacy, although those roles are critically important, that they're able to give patients their medicines, but there's lots of roles beyond that. When I was in school, we had a professor that came who actually worked at the VA in Durham, and she came and she sort of talked about what she did day to day. She also did our hyperlipidemia lecture, which is for high cholesterol. And I just went and asked her, I was like, hey, can I spend some time shadowing you just to see what it is that you do? This sounds like something I could be interested in. And so I went and spent some time at the VA with her. She had residents and students with her. So we spent the first part of the morning. She was teaching them. We were reviewing patients for the day. And then we actually got to go see those patients together. And I'll never forget that experience, because the way they were able to really take their medication knowledge and expertise and then apply that to a patient who's an expert, who's an expert in their life, and combine those two things. I'll never forget, our particular patient was actually visually impaired, almost to the point of being blind. And so they had tried several different things to help him really manage his medicines, know which bottle was which medicine. And so they had come up with this system of different types of textured stickers and rubber bands. And so hearing them go through those medicines with him and making sure that he knew what they were for, had a good system for remembering them, despite the fact, that he had a visual impairment. I just loved that. I loved the creativity. I loved the learning that was happening. I loved the relationships. I'm a relational person. So seeing them get to spend time with the same patients over and over and develop those relationships and trust, I knew in that moment that's what I wanted to do in pharmacy. And so that was about midway through pharmacy for me. And then to be able to have a career like that at a VA or in a physician's office, usually it requires some extra training. And so when I finished pharmacy school, I knew that in North Carolina, Asheville was sort of the place that you wanted to be for what they call ambulatory care pharmacy or primary care pharmacy. So came out to Asheville and did a residency and haven't really looked back since.
Very nice. Well, Rebecca, what specific roles do pharmacists play, and how do they contribute to improving patient outcomes in the value-based care model?
Yeah, pharmacists are the medication experts. We go to school for an additional 4 years to get a doctorate degree to really know all about the medicines. And one of the physician colleagues that I've worked with, I think she said it better than any way that I could say it. She always talked about a pharmacist and a physician partnership as sort of being like a Venn diagram, right? So the physician has a sphere of knowledge and the pharmacist has a sphere of knowledge, and there is some overlap. But, she knows so much more about the disease states, the diagnosis, the nuances. But then I know so much more about the medicines, the administration, the interactions. And when you put the two of those things together in complementary skill sets, it can really advance patient care. And so when you think about, value-based care and our move from fee-based payments to value-based payments, medications are such a big part of that, right? Like there's issues with adherence, there's issues with access. And then once you get past that, you have to think about, how do I optimize the medicines? Sometimes that's picking the right medicine for a patient based on their comorbidities, their interactions. Sometimes it's also just taking medicines away and recommending de-prescribing. So it can be sort of a combination of all those things. And so because medications are always going to be an important part of chronic conditions, when I think about outcomes and value-based care, having a medication expert on the team, I think is crucial for being able to achieve that at, in a way that's patient-centered, a way that's cost-effective, and a way that supports our physician colleagues and, helps with their satisfaction and well-being.
Outstanding. Well, one of the things that we hear a lot about is medication adherence and how important that is for positive outcomes for our patients. How would someone such as yourself address medication adherence issues, especially related to social determinants of health or things where it might not just be a conscious decision, but just something that seems more of a struggle than it's worth? And how do you engage patients to make sure that they're going to adhere to those treatment plans so that they will feel better, so they'll become healthier, have better outcomes?
Yeah, medication adherence is sort of a tricky thing, and it's something that I've worked with, throughout my career. And for me, I think when I think about medication adherence, I think about it in two parts. The first part is almost like the psychology of medication adherence, which I can talk more about. And then the second part is the practical nature of medication adherence, right? Like, how do we support the adherence once we've sort of figured out the psychology of it? So when I'm approaching, or our team is approaching, a patient around a medication, and we're thinking through their adherence, I think it's important to approach it with curiosity about the adherence issue and a non-judgmental approach. We have no idea why that person is being non-adherent. They may not even know they're non-adherent, right? So there's unintentional non-adherence and there's intentional non-adherence. One example in my career, I used to work in a heart failure clinic at a cardiology practice. And in the world of heart failure, there's a lot of medicines that we put patients on that are really to preserve the muscle function of their heart. But, when you look at the bottle, it'll say, metoprolol, 50 milligrams, take once daily. And then that medicine is very common for blood pressure, for example. And so I would have a patient come in to our clinic, I'm reviewing the medicines, making sure they can get them, making sure they're taking them. And they're like, oh, I'm not taking that one anymore because my blood pressure's fine, right? And so in that example, no one had ever explained, well, yes, your blood pressure's fine, but this medicine also helps preserve your heart. That's just a simple education intervention. What I have found, though, is usually education is not what people are lacking. There's something else behind it. I think people from a psychological standpoint view medications at times as failures, right? As personal failures. I felt that myself. I have a chronic condition. I remember going to my primary care provider and she prescribed a medicine and she was like, I just want to take a second to acknowledge, how are you feeling about this? That you're starting a medicine. And that was so refreshing that she asked that, because unfortunately, as a society, we do view medications almost as a personal failure, or oh, we couldn't handle it on our own, when that's not the case, right? So really talking with people about that and what is your goal, right? Our job is not to fix people, it's to help people meet their goals. So if your goal is to live healthier, your goal is to play with your grandchildren, your goal is to be able to, walk a mile. If medication is part of what helps you achieve that goal, really understanding how medications fit into that. Thinking really to the psychology of medicine. Another example that stands out for me is insulin. When folks have diabetes and they get put on insulin, people have lots of strong feelings about that. It could be needle phobia, but it could also be that really in diabetes, I've heard providers threaten people with insulin, right? If you don't eat right and you don't exercise, I'm going to have to put you on insulin. However, what we know is that because of the progression of the disease, some people, if they were the perfect patient, are going to end up on insulin anyway. So some of it is just making sure that we as healthcare providers are mindful about the messages that we send, and that we're not using insulin as a last line therapy. I've had patients that have said to me, well, I don't want insulin because when my uncle went on insulin, he lost his limb. He had to have it amputated. And so they view things like that as oh, that's when you get the bad diabetes, you're put on insulin. So I think some of it is just unpacking, what is the root cause of non-adherence and how do we deal with the psychology of what's behind that. Some of that has to do with trust, right? So going back to those patient relationships that I was talking about, that they're going to trust me, that I have their best interest at heart. And sometimes that's just planting a seed. I may not be able to impact it on that day, but I know if they know that I'm a trusted professional and provider and I'm working with their physician, that over time, we can move towards something that will improve their health outcomes. So that's sort of that first part that I think through is, okay, what is the psychology of that adherence issue? And then you move to, okay, once we've gotten around that or we figured out the issue, are there practical ways that can help someone improve their adherence? And what does that look like that we talk about from, a shared decision making with the person? Because they're the expert in their life. They know what's going to work. I don't. I can help them brainstorm, but really trying to lead them to a solution. Sometimes for people that's setting alarms on cell phones. Sometimes it's getting, a 90-day fill from a mail order pharmacy. And so to your question, Thomas, when you asked me about social determinants of health, if transportation's an issue, right? They don't have a car or they don't drive, mail order is a great choice. Some people don't want to do mail order, and that's okay. They have relationships with their local pharmacist, which I believe those are crucial, and can be really important for a lot of patients as well. Pill boxes, pill packaging that a lot of the local pharmacies can do. And so there are lots of practical things that we can help to support adherence as well. Having those conversations with patients. Again, my job is not to push an agenda on someone. My job is to help them meet their healthcare goals and to give them the knowledge that I have as a medication expert, but knowing full well that, they're the expert in their lives, what they're willing to do, how they feel. And so for folks, who don't want to take medicines, I think some of the conversation is, okay, what are the things that you can't control that put you at high risk? I just feel people should be informed. Even if they're not going to do what I recommend, they should be informed, right? So yes, genetics play a part. Yes, if your first degree relative, so mom, dad, brothers, sisters, children have had a heart attack or stroke, you're at higher risk, right? So just kind of getting all that out of the way. But then, okay, what are those things that are in our buckets of control? And that's where, those lifestyle modifications, like you mentioned, the physical activity, not even exercise. Some of our folks just get up and moving. Just those activities of daily living can be important. And then also, nutrition. Those are things that we can control. We can stop smoking, and then so just helping guide people through some of those decisions as well. I've been very fortunate to have a career that's been rich in team-based care. So usually at my disposal, I've had not only physicians or APPs, I've also had nutritionists and social workers and even peer support specialists that can really support patients, in all those different facets when they're making those decisions about what they want to do to have their optimal health and what their goals are at the time.
Well, that's a great segue into our next question, because I wanted to talk to you about pharmacy collaboration with care providers who aren't pharmacists. So you mentioned earlier the two spheres, and they don't all necessarily overlap. And so I feel like if you have a clinical care provider and then you have a clinical pharmacy care provider, how do you work together? How do you develop a trust so that you can use a team-based approach for the patient, for the good, so you can achieve the better outcomes? How would you go about doing that, bridging that gap?
Yeah, that's a great question. And I feel like in my career, I've experienced sort of the full spectrum of what that looks like. So just to tell you a story, I alluded to the fact that I had worked in a heart failure clinic and a cardiology office. And I got that job because of a grant that I was actually partnered with a nurse to try to prevent readmissions for people with cardiology. So this cardiology office had never had a pharmacist. And so I remember when we were talking about sort of those early conversations, when we were talking about incorporating the pharmacist into the team, I'm sitting at a table. The scheduling supervisor is there, the business office supervisor is there, the lead physician is there, and we're talking about my schedule and about how I'm going to see patients and how we're going to coordinate. And finally, and I appreciated this so much, finally, the scheduler stops and she goes, "Can I just ask you, what is it that a pharmacist actually does? What are you going to be doing?" And then in that practice, I remember after I was already established and seeing patients, one of the medical assistants, I could hear them down the hallway, was walking back with a patient, and they were explaining, yeah, you're going to meet with our pharmacist first, and you're going to meet with your physician assistant, and they're going to go through all this with you. And the patient goes, why am I meeting with a pharmacist? And the medical assistant was just sort of like word jumble, right? Just mumbling, and they couldn't really explain it. And so I think some of it, it just takes time and takes exposure to really understanding how a pharmacist or a pharmacy technician can support you. And what I've found is that, once they understand, they never want to go back. They always want a pharmacist. So even after I left that position, they actually end up hiring 2 pharmacists to be in that role. And so some of it is just awareness of, okay, kind of going back to my mom. My mom has no idea what I do, but just so making sure that people know that pharmacists can do lots of things. That includes being in the retail pharmacy, in the hospital, in pharmaceuticals, but also in your primary care offices or your specialist offices. The other thing that I have found really helpful when working with care teams is, especially in the beginning, is being mindful of how busy primary care is and how much they have going on. It's not even just taking care of the patient. It's making sure everything's documented correctly in the EHR. It's dealing with all the paperwork that comes in. So I take the approach of I'm going to be as helpful as I possibly can. I'm not going to add any extra work for them, and I'm going to try to actually decrease the work that they have to do. I've taken that approach, and some of it, like you, I think, mentioned, Thomas, is this like trust that, hey, I'm going to take care of your patient just like this was my grandma, right? Like I'm going to make sure that I'm going to care for them just like you would want me to care for them, just like they're one of my family members. So developing that trust, knowing that you're going to care for the patient just like they would, not increasing their workload, and practically to really get your foot in the door, I think if you can help get medicines, so help with medication access, that is kind of the first logical place to start. You know, if they're struggling getting a diabetes, some of the newer expensive diabetes medicines for their patient, and you can make that magic happen behind the scenes, that's something that they appreciate because they know it's going to benefit the patient and decrease sort of the work that they had to do. And so, you know, in my last job, it's kind of funny, I experienced the opposite end of the spectrum, where most of the physicians were like, Rebecca, if you feel comfortable with it, you just do it. Anything that you can do that I don't have to do, you know, I appreciate. And so we had that level of trust where, hey, yes, I'll do it for you. You know, I'll make sure I'm taking good care of the patients. I'll do it within my scope of practice to really make sure that we're being synergistic as we're, you know, caring for patients.
That's awesome. Well, Rebecca, I'd love if you would stick around and have a further conversation with us, because there are some questions that I would like to probe about pharmacy and your role and value. Would you be willing to stick around for a little while?
Yeah, I'd be happy to do that.
This is the Move to Value podcast, powered by Chess Health Solutions. We hope you have enjoyed this episode. If you would like more information about this and other episodes, you can head over to movetovaluepodcast.com to check out all of the available resources. If you're interested in continuing to hear about value-based care and how it impacts you, you can sign up for our email notifications or subscribe to this podcast on your favorite podcasting platform. Also, we would love it if you would share the Move to Value podcast across your networks and leave a rating or review. Thanks for listening.